Hello everybody, I'm Dr. Reilly at Fairview Chiropractic Center. Today I'm going to talk about frozen shoulder, a condition that we see in the office and have a lot of success treating. As a board certified chiropractic sports physician and advanced trained myofascial release practitioner called Graston, we see those techniques be very helpful for frozen shoulder. So a tip-off of what frozen shoulder looks like is you cannot move your arm higher than this, and it's near impossible to put your hand behind your back and put something, take a wallet out of your back pocket. Frozen shoulder goes through 3 stages. There's the painful stage, which is initial, very painful, it's an inflammatory time, and the research shows that it can last 2 to 9 months. And you may have trouble sleeping, starting to have trouble raising your arm. You may have been diagnosed with bursitis or tendonitis, but really it's early frozen shoulder. Phase 2 of frozen shoulder is called the freezing time, or frozen. Studies show that can last 4 to 12 months. And in this phase, that's when you're usually diagnosed with frozen shoulder, because you can't raise your arm or put your hand behind your back. Right? And then that moves into the 3rd stage, which is called thawing. And this process happens for most people. The time frames can be different, but studies show that the thawing phase can last 5 to 26 months. So you're looking at a condition without any treatment that could last for 3 years. The first phase being very painful, the second phase being freezing up, the 3rd stage gradually improving. Today's standard medical care is PT for months or years, trying to increase range of motion. Next step is sometimes injections, sometimes this procedure called manipulation under anesthesia, and finally some surgeons will do surgery to work on what's called the joint capsule. So those are the standard treatments. What we use here are 3 or 4 technologies and therapies that can make a difference almost immediately. We use something called class 4 laser that goes inside the shoulder joint into the capsule and reduces inflammation and pain. It actually softens up the tissue. Then we use a technique called neuromuscular re-education. It's an advanced form of reconnecting the brain to the spine nerves, to the shoulder muscles, and it can often instantly increase range of motion by using that technique. It's called Trigenics. You can look that up on the internet. And then 2 other techniques that we commonly use are myofascial release, where the type of myofascial release we use is called Graston therapy, which is used in just about every pro sports locker room. And it can break up that scar tissue that forms, that restricts movement. And finally, we use a pulse wave technology that sends an energy wave into the capsule deep into the shoulder, brings blood, and has the ability to stimulate mesenchymal stem cells, which regenerate and repair that joint. If you've been diagnosed with frozen shoulder and you're suffering with that, consider giving us a call and getting assessed for that. It can be very helpful. Thank you.